I lost like 10 pounds on that rotation. The day I found myself sneaking to eat a tangerine in the stairwell, that's when I knew the jig was up. And she said, I don't think you're going to match into any specialty. Within 2 weeks, I knew that I was going into pathology, and I have not turned back since. Hey boo, this is Zatsa Amwa. Today I'm going to be talking to you about how I ended up going into pathology. When I first started medical school, I wanted to go into trauma surgery. Like that was it. That was all. There was nothing you could tell me. I remember I went into one of my advisor's offices one day, and before she could even open my file, I sat there and I said, I know exactly what I want to do. I'm interested in going to trauma surgery, and I just need you to help me figure out how to get there. She opened my file, she looked at it, and she closed it, and she said, honestly, I don't think you're going to match into any specialty, let alone surgery. She proceeds to tell me how she's got other students who have higher step scores than me that she's having difficulty getting an interview for. So at this point in time, I should consider other careers outside of clinical practice. Yes, she told me these things. I don't let anybody tell me what I can and cannot do. If I allowed that, I would never have made it into medical school. What will ultimately turn me off of surgery was my actual surgery rotation. Man, when I say that thing was hard, like I was waking up at 3:45 so I could go pre-round on my patients, and then we would do rounds, and then we'd have our procedures and everything. And then, you got to show interest. You got to show that you dedicated. If there was a case going late, sometimes I would volunteer to stay for that surgery. Like there were times I woke up at 3:45, did everything I had to do, didn't leave the hospital until 9 p.m. And then you come back and do it again. I lost like 10 pounds on that rotation because like the day I found myself sneaking to eat a tangerine in the stairwell, that's when I knew the jig was up. It wasn't no way I was going into that specialty. So now I'm like crunched because at this point I'm a fourth year. I didn't like anything else other than my trauma. Now that was my general surgery rotation. I still loved the trauma surgery portion of it. I still to this day love trauma surgery, but I just knew that I was not going to be happy. So I had to figure out what I was going to do in a relatively short amount of time. For a minute, I said, okay, let me try internal medicine. It wasn't so bad. I did all right on the rotations, et cetera, et cetera. But child, that internal medicine rotation opened my eyes to the fact that I am in fact an introvert. And it's not that I don't love my patients. Let me tell you, I love my patients. Wonderful people, interesting stories and everything. But when I'm strapped and I got other things to do and I got other patients to see and I got other notes to write before I can leave this place, and you sitting here wrapping me up telling me stories of yesteryear, like, no, I'm sorry, I can't. By the end of the day, I would be so drained. Yeah, no. Fun fact, I actually did apply for internal medicine at one point in time, but that did not work out. I ended up not matching that year, and I was encouraged to postpone my graduation by a year. So that's what I did. I spent another year doing other rotations, and this time around, I told myself that I need to do some rotations in specialties that I had not entertained before. Now, the backdrop to all of this is I had already stated that I was never going to go into pathology. And I really had no interest in pathology at that time, but your girl was running out of time. So I had to start looking into things that I had never considered in the beginning. So I lined up all these rotations. I started with pathology, and within 2 weeks of being on that rotation, I knew that I had found a specialty for me. First of all, people were happy. People loved their jobs. People were excited to see you. people were pleased and impressed that you would even step your foot into the pathology department. And I was like, wow, that's crazy. Every day we would go and sit and sign out with the attendings. The residents discuss those cases that they had already previewed with the attending. The attending would look at it and also, give their thoughts and do some teaching. And during those sign outs, like I just felt so much excitement come over me. Like I just could not wait to see what was on the next slide. I could not wait for the attending to reveal what the abnormal finding was on the slide that we were looking for. I could not wait to see like what the next organ looked like under the scope as compared to the organ that we just saw, et cetera, et cetera. And everything it was like I was on this adventure. Like it was just a whole new world that I had never experienced, because in other specialties, you have your patients, you go talk to them, you figure out what's going on, et cetera, come up with your plan, all these other things, follow up, order tests, yeah, right? But this was completely different from all of that. It felt like my job was to look at art, or it felt like my job was to kind of be a detective looking at the slide. And it was very intriguing to me that I had no idea what I was looking at, but the attendings would look at it for like 2 seconds and be like, oh yeah, this is cancer. Or, oh yeah, like this is an abscess, or this is an adenoma, or whatever it is. And I was like, oh my goodness, I would love to be able to do that. I would love to be able to just look at a random image under the microscope and know so much about what's going on with the patient. One experience that stood out to me that really solidified that I would consider going into pathology, I was sitting in sign out with the gastrointestinal surgical pathologist on service that day. And he was teaching me how to read GI biopsies, most of them having been polyps. He was like, okay, when you look at this one, you're looking for the colors to look like this, and it should be darker here and it should be lighter here. If you see that, then that means that there's a good chance that it's this kind of adenoma. And I'm like, okay, like dark versus light, I can do that. So that's the simplified version. Obviously, there's more to it than that. But we're going through, he's showing me the different shapes of different types of adenomas, et cetera. And he would put a new slide on and he'd say, okay, now what do you think this is? And I'd be like, I think this is tubular adenoma. And he'd be like, that's correct, that's tubular adenoma. And I'd be like, After getting several of them right in a row, he said to me, he was like, you have been able to learn in 2 weeks what I've been trying to teach certain residents for 2 years. And I was like, one thing that I did not mention that is absolutely important to this story is I struggled a lot academically. And because of that, my relationship with what I was learning was impacted. I felt really disconnected from what I was learning because I had such a hard time translating what I knew into good scores and good grades. And my relationship with medicine suffered. So to have someone sit there and tell me that I did something right and it was something that I was actually excited to do and was enjoying, that was it for me. It was a done data. So completely switched my trajectory. I was no longer going to pursue internal medicine, surgery, nothing. Like it was pathology or bust. And I remember I did have to complete other rotations after that. And I wanted to do that just in case there was something else that I preferred. And nothing came close to my experience in pathology. So I knew within 2 weeks, I knew that I was going into pathology, and I have not turned back since. I love my job. Like, I love my job. I also consider myself to be a creative. I'm someone who is also very much stimulated by beautiful imagery. I have access to that through my job. I consider looking at tissue under the microscope as body art. Like, that's literally what it looks like. If you get some time, this could backfire, but if you get some time, like go online and search for normal colon histology. Look at how gorgeous that is. Like everything is just so perfect. Another thing is when I was little, I used to do a lot of different types of puzzles with my grandmother. So we would do like word find puzzles. I used to do a lot of like the Where is Waldo kind of things, or like those games where you have to look at two images that are similar, but there's something different between the two of them. You'd have to figure out what the differences were. Anything like that, I love doing and I was really good at. So when I'm like looking at cases, it's the same type of thrill that I get from figuring out a puzzle or finding something. The same type of gratification that I get from playing those games is the same type of gratification that I get when I'm looking at slides and trying to diagnose the patient or determine if there's notable pathology present. And on top of that, I'm doing something amazing for my patients. Not only do I enjoy the actual work, but I also get fulfillment because I know that the work that I'm doing is making a significant impact on someone's life. And probably one of the most important things that I should mention about why I love my job is the appreciation that it gives me for life and for, you know, just my body in general. Like I've seen what some of the things that we do, the choices that we make can do to our bodies on a cellular level. I've seen people coming into the morgue in pieces, literal pieces, from going too fast on their motorcycles or just drug overdoses or whatever it is. And I mean, I already value my life, but being a pathologist has absolutely made me value life and people, the earth, literally everything. My relationship with myself has improved. I could go on and on about the things that I love about pathology. I'm just gonna keep it there because I just wanted to share my own story about how I wound up in this field. And I really encourage those of you who are considering going into medicine, or if you're in medical school and you're trying to figure out what kind of specialty you want to go into, really take the time to consider pathology. It is not enough to just have your medical school pathology curriculum. Had I not done that rotation, I would never have known how much I actually enjoy the work. The way that pathology is taught right now is very two-dimensional. You need the practical component of pathology in order to fully understand what your life could be like if you went into pathology. What we learn in school is the tip of the iceberg. This is part of the reason why, number one, a lot of people don't go into pathology because, let's just be real, sometimes it's boring when you're learning it in medical school. I can say that, like, I definitely was bored. Not because the instructors were boring, but because the way we were learning it was so flat. Number two, because it's not mandatory to do a rotation in pathology, you would never know what it's like. People are just going based off learning some facts, learning some images, and regurgitating that information on an exam. Whereas there's this whole world of medicine that a lot of medical students will go through the entire curriculum without having experienced. I would strongly, strongly recommend that if you have an elective, even if it's just like a quick 1 week thing. Several pathology residents that I have spoken to thought that they wanted to go into another specialty prior, but because, let's say, they were on their surgery rotation and they decided that they wanted to follow a specimen down to the frozen room, or because they went through the rotation for the other specialties and they were like me and they were like, I'm not going into anything else. Let me just see what pathology is about. And then they ended up loving it. So even if you think that you will never, like, again, I literally uttered the words, I will never go into pathology. I believed that when I said it. I'm so glad that I ended up in this specialty. So even if you believe that you would never want to do pathology, just go and experience it. See if you can spend some time in the frozen room. See if you can spend some time with autopsy. See if you can spend some time on apheresis. There's so many different types of pathology that people do not know about. So do the rotation, just spend a little bit of time. Even if you can't do the rotation, see if you can shadow different subspecialties within pathology. Don't just do one, because if you don't like that one, then you're going to assume that you don't like pathology. But there are so many different subspecialties that are practiced many different ways. There are so many different elements within each subspecialty. Different subspecialties can require different skill sets. And so it's really important that you sample a little bit of everything, just so that you can get a better sense of the breadth of the field and have a diversity of experiences, so that when you're making your decision on what you want to specialize in, you're actually coming from an informed place and not just mixing it because it looks boring. So I think that's gonna wrap me up for today. I'm hungry too, child, so I need to go and get something to eat. But please let me know if any of this resonated with you. Let me know if you're considering medicine or if you're considering pathology. If you have any questions, you can leave those questions in the comment box. And I'll try my best to answer those questions. I hope you do consider pathology when you are determining what specialty you want to go into. Till next time, we'll chat later. Bye.